Hello and welcome back. If you're caring for someone who is incontinence, bedbound, or wearing briefs regularly, this video is for you. Today, we're talking about moisture-associated skin damage. We'll cover what it is, how to prevent it, and most importantly, how to treat it when the skin is already red, inflamed, or even starting to break down. I'm a wound care nurse, and this is one of the most common and most preventable skin issues I see. Let's start with the basics. Moisture-associated skin damage happens when the skin is exposed to prolonged moisture, usually from urine, stool, sweat, or wound drainage. Over time, that moisture breaks down the skin barrier, making it red, irritated, painful, and in more severe cases, open or weeping. This is not the same as a pressure injury, but it can absolutely cause tissue to break down quicker in these spots. When skin stays wet, the pH becomes more alkaline, enzymes in the stool starts to digest the skin, friction from briefs or movement worsen breakdown, so now you have moisture, friction, bacteria, which is a complete recipe for skin damage. If you take anything away from this video, let it be this. Prevention is everything. Make sure to have timely changes. Don't leave somebody sitting in a wet or soiled brief. Check every 2 hours minimum or more often if needed. 2. Gentle cleansing. Avoid harsh soaps, scrubbing, and hot water. Instead, use a pH balanced cleanser, no rinse foams or wipes, and always pat dry, never rub. Number 3, moisture barriers. This is your best friend in moisture-associated skin damage prevention. Look for zinc oxide-based creams, dimethicone barriers, or protective ointments. Apply a thin, even layer after every clean. Number 4, breathability and brief choice. Avoid overly tight briefs, use breathable products when possible, and change frequently to reduce humidity buildup. Number 5, reposition. Even though moisture-associated skin damage isn't a pressure injury, moisture plus pressure equals faster breakdown. So reposition every 2 hours if bedbound. Now let's talk about treatment. Stage 1 is red, intact skin. Cleanse gently, apply your barrier cream constantly, and increase frequency of brief changes. At this stage, you can reverse it quickly if you stay consistent. Stage 2 is inflamed, denuded skin. This is where it looks bright red, shiny, wet, or weeping. Now we need to step it up. Use a thicker barrier paste like zinc oxide. Avoid wiping aggressively and use soft cleansing methods. Consider leaving protective products on instead of removing them each time. You don't always need to scrub off the barrier cream fully. Just remove the soiled layers and reapply. Stage 3 is open areas and skin breakdown. If the skin is open, clean very gently. Use a non-adherent dressing if needed, and continue using barrier creams on the surrounding skin. Keep the area as dry as possible at this point, and consider involving a nurse or wound care specialist, as we have great products we can suggest and different dressing hacks that are meant for difficult to dress areas like this. Here are the most common mistakes I see all the time. Overcleaning and scrubbing the skin, not using a barrier cream constantly, leaving wet briefs on too long, using powders as they cake and trap moisture, and assuming the redness is a pressure ulcer when it's actually due to moisture. Here are my pro tips. Cleanse, dry, and always use a barrier. Use soft cloths or disposable wipes, not rough towels. Nighttime care is just as important. Set a schedule if stool is frequent, as barrier creams need to be applied more often. If you found this video helpful, don't forget to like and subscribe as a free way to support my channel so I continue to grow and reach more people. And if you have any questions or specific situations you want me to cover, make sure to leave them down in the comments. I'd be happy to help. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.